Hello, my name is Don Bacon and I represent Nebraska's 2nd Congressional District. Recently, the U.S. House of Representatives mounted a rescue mission to save healthcare and passed landmark legislation that gives individuals and states more control over our healthcare policies, allowing for patient-centered healthcare while removing federal bureaucrats from the decision process. The American Health Care Act, or the AHCA, is a first step in the right direction and repeals much of Obamacare. This bill lowers costs, will expand choices, and protects people with pre-existing conditions. Obamacare has failed the American people. If we continue down the Obamacare road, it will eventually collapse on itself, and we cannot let this happen. All over the United States, Americans are suffering under Obamacare. The Des Moines Register reported earlier this week that Medica, the last insurer selling individual health policies in most of Iowa, may stop selling individual health policies in Iowa. This will leave over 70,000 Iowans without any options. Here in Nebraska, I have talked to folks all around Omaha area, and I keep hearing the same thing. Obamacare is filled with broken promises. I have heard from Nebraskans who can't afford to pay their out-of-control, skyrocketing premiums, which in Nebraska, health insurance premiums have increased by 51% over the past year alone. I heard from a young mother who is on Obamacare and has a $12,000 deductible. She had to pay for the delivery of her child out of pocket because it's an outrageous deductible. I've also heard from many Nebraskans like Janine, who had the insurance that she liked and could afford, but she saw her premiums double with the implementation of Obamacare. Then her plan was dropped, forcing her to get a plan on the exchange that did not include her dentist or pharmacy network that she had been using for 30 years. These are real-life problems created by Obamacare that will be fixed with the implementation of AHCA in the bill that I voted for. Obamacare has hurt Nebraska's small businesses. Many of Nebraska's small businesses are not hiring or expanding because of the cost of healthcare coverage. Likewise, Obamacare has hurt many of Nebraska's employees as they have had their hours cut as their employers couldn't afford mandated employer health coverage. The American Health Care Act, which will fix our healthcare system by expanding health savings accounts and giving age-based tax credits for those who purchase their own insurance to give them parity with those individuals who receive employer-provided coverage tax-free. This proposed legislation will also repeal major flaws of Obamacare, including the employer mandate and the individual mandate that has crippled our healthcare system. The AHCA will give millions of Americans more of a choice when choosing a health care plan that best fits for them. The AHCA does all of this while still maintaining coverage for those Americans with pre-existing conditions, even in those states that have been granted a waiver. The AHCA will make healthcare more affordable and accessible. CBO estimates that the AHCA will lower premiums by 10% over the next 10 years. It will reduce the federal deficit by $337 billion by 2026 and lowers taxes by $883 billion, providing massive tax relief for the middle-income Americans and small business owners. In the coming weeks and months, I, along with my House colleagues, will be working on other legislation aimed at further fixing our healthcare system and providing individuals with choices on health insurance in an open and transparent manner. This includes recent legislation that passed the House allowing small businesses to form associations and negotiate group insurance across state lines, and legislation passed that requires insurance companies to comply with the same antitrust and unfair practice laws as all other businesses. This would subject insurers to federal laws against price fixing and bid rigging. As always, I look forward to hearing from our constituents and encourage you to call or write me with any concerns you may have. Thank you and have a good day.